So what we don't want to do is blame and shame families that are really trying the very best they can, but need some extra support.
Welcome to the Riverside Project podcast. We are mobilizing Houston to empower families and transform generations. We hope these conversations will give you a greater understanding of the issues facing our community and inspire you to find your place along the river. Hi, everyone. Welcome back to the Riverside Project podcast. My name is Amber Knowles. I'm the founder and executive director of the Riverside Project. Today, we have Dr. Melissa Merrick. She is the president and CEO of Prevent Child Abuse America, the nation's oldest and largest nonprofit dedicated to preventing child abuse and neglect. With more than 20 years of clinical research and leadership experience, she is a nationally recognized expert on adverse childhood experiences, or ACEs. She previously served as a senior epidemiologist at the CDC, where she led the ACEs study and authored the agency's landmark Vital Signs report on this topic. Dr. Merrick is also a principal architect of Thriving Families, Safer Children, which was a national effort to reshape child welfare through equity and prevention. In light of April being National Child Abuse Prevention Month, we're thrilled to have her join us to share about her work and how we can all be working together to make our communities a place where children can heal and thrive. Dr. Merrick, thank you so much for joining us on the podcast today.
So happy to be with you, Amber.
Well, as we start off all of our podcasts, tell us a little bit more about who you are, how you came to be in the role that you're in, and just a little bit more about you.
Sure. Well, hi, everyone. So happy to be with you this April, Child Abuse Prevention Month. First and foremost, I'm a mom. I have two teenagers, 17 and 14. They really keep me on my toes. Professionally, let's see, my training was as a child clinical psychologist, which many people mistakenly think makes me like so good at parenting. But of course, the truth is there's no perfect parent. Yeah, I wish. We're learning every day and trying to do the very best we can do. And professionally, I really, as you said in my bio, I've sort of had the opportunity to lead and be a part of just a reshaping and a contemplation of how our systems need to support families on the front end instead of waiting for them to be in crisis to fix them or fix kids, really trying to figure out how to bring a public health framework to this work of prevention. How do we assure the conditions that make it so that all families have what they need in their own communities, delivered with love and trust and respect, and that all of that happens before kids and families are in crisis. So that's what I mean when I talk about primary prevention. And that's the work that we do, of course, here at Prevent Child Abuse America through all of our state chapters, our home visiting, Healthy Families America sites around the country. And we recognize that we can only do this work in partnership. And so happy to be here as a partner to you and to all the listeners, and recognize that there's just a role for all of us to play in figuring out how we make sure every child and every family can be safe, can be supported, and can thrive.
I love that you're speaking our language. We know that this is not something that one organization or one person can do. We all have a responsibility in keeping kids safe and helping them to thrive. And so I love that that's what you're about too. I think it's important maybe to start off with just a definition of child abuse. I think maybe there's a lot of myths out there or different ideas about what is child abuse. I think it probably can encompass more than what we just think about when we hear the term. So can you start off just by defining for us what is child abuse from your perspective?
Absolutely. And, even we get this question a lot because, of course, our name is Prevent Child Abuse America. But let me be really frank and maybe a little bit nerdy in terms of my science background here. But, child maltreatment, I think, is sort of the umbrella term. And that is the work that we're trying to prevent, right? And child maltreatment, there's child abuse, so acts of commission, something that a parent or a caregiver does that results in harm or potential for harm or threat to a child's health, safety, or development, right? That is one bucket of work. Things like child physical abuse, I think, is sort of where people go when they hear child abuse. They think of, broken bones and bruises and that kind of thing, but sort of sexual abuse, we have emotional abuse. Then we have this whole other sort of bucket of child neglect, right? And that is really acts of omission. So something a parent or caregiver fails to do or to provide to a child that may lead also to potential for harm or result in harm, and threaten the child's health, safety, or development, right? So this is things like physical neglect, right? This could be things like emotional neglect, medical neglect. Truth is, we're trying to make sure that we can get on the front end of all of that, right?
Hmm.
And recognize that in this country, child neglect in particular is often confounded with poverty. So
Yeah.
what we don't want to do is blame and shame families that are really trying the very best they can. But need some extra support, and whether those are relational supports or concrete supports, economic supports. But really, that's sort of the bucket. And so, really, what I think the whole field actually is trying to do, but certainly we at Prevent Child Abuse America are trying to do, is to get in front of those things, right? How do we assure the conditions, the environments that meet children and families' needs, that help make child abuse and neglect perpetration actually obsolete, right? How do we prevent it from ever happening before a family is in crisis?
Yeah, and you're talking so much about that prevention. We, at the Riverside Project, of course, we use this idea of the river where, there's what's in front of us. There's things that are happening downstream when we don't get to stability. But there's also this big part of it, which is going upstream and understanding why are kids and families in this kind of proverbial river, and what do we do to prevent that? And we know there's things like you mentioned already, poverty is a huge indicator for child abuse and neglect. There's also homelessness, there's addiction. And so we often talk about, responding to abuse. We have systems in place to respond once it already happens, but we don't often spend a lot of time thinking about how do we prevent it. And so I wonder, kind of, when you think about really true upstream prevention, what do you think that really looks like in communities? And where have you seen that maybe happen, or initiatives that you've seen across the country, or even just in your own work that are really getting at that prevention? It's one of those things like, how do you prevent a problem from happening in the first place? How do you track it? All those things. But
Yeah.
I just wonder what you've seen in that.
Yeah, absolutely. Well, I do think that it's this, upstream versus downstream. I like how you simply put that in that kind of river analogy. That is what the work of public health, and that is what the work of primary prevention is. How do we go as upstream as possible before families are in crisis to make sure they have the conditions for bonding with their babies, for meeting their baby's needs, for meeting the family's needs, right? And recognize that needs are social and developmental, intellectual. They're also economic and concrete, right? So when we really think about, policies and big systems that can really support families, we're talking about things like paid family leave, for example, right? This critical newborn period all the good stuff is happening in that baby's brain, but it requires that connection with a parent to really, that serve and return, all the good stuff that's happening. We want people to be able to afford to stay home
Right.
in those critical periods to really bond and make those wonderful brain connections. This is stuff like affordable childcare too, right? Like so many families don't have access to high quality, affordable childcare, stable housing. I think you put, right, all the things that are needed, social connections. I mean, we saw this, of course, firsthand, all of us who were parents during a global pandemic. Parenting is always hard, but parenting in a time where there's acute racial and civil unrest, you have no access, even if you can afford childcare, there isn't any childcare. And every parent was just overloaded, right? So when we talk about going upstream, we mean not a program per se, right? We don't mean parenting programs. Those are also really important parts of a prevention continuum. But what we're saying is like, how do we make sure the environment, the community environment, the socio-political environment is rich with supports for families, right? That's what we mean by upstream. I also think, in your river analogy, I've seen this in public health a lot, where you can throw rafts down the river to save, the people that are drowning, right? Versus you can go upstream and see like, why are all these people falling in? And I would say that we've also learned there's even a step before that where there are structural factors pushing certain families into that river,
Yeah.
right? And so this is also our work to really, look at historical patterns, to look at what's on the roots of child
Hmm.
abuse and neglect, the roots of trauma. It's generational, right? So we mean all of those things when we're talking about upstream. Again, making sure that families have what they need, because we know that when families have what they need, their children are safer, right? And we're all in the business of wanting kids to thrive and to be safe. Well, the safest kids are in healthy, safe families that live in healthy, safe, supported, connected communities, right? And hopefully in a country that has policies that help to maximize the potential and the opportunity in our young and budding families and children.
Yeah, that's so helpful. There are two things that you mentioned that I want to pull out, and you can answer or speak to them in whatever order you want. But one is trauma and the impact. You mentioned trauma being generational, and when you talk about the root, the trauma aspect and the impact of trauma generationally. And when a parent has been through significant trauma, we see this cycle continue. And so there's that aspect. And where would you say that that impact is, and how does trauma influence an ability of a family to thrive in this way? And then kind of connected is the impact of relationships in that. You mentioned community-wide, we know that relationships, even between socioeconomic statuses, and being able to overlap. We often see cities, especially a city like ours, where it's really segregated in terms of race, but it's also segregated in terms of socioeconomic status. And when everyone is separated, it makes it harder for everyone to thrive. And so, like, where's how would you speak to kind of the impact of relationships in this kind of whole ecosystem?
Well, first of all, I'll start there. Relationships make the world go round, right? We all know that. And we need healthy, strong, safe, stable, nurturing relationships and environments for people to thrive. And I think we've long known that for kids, right? I'm trained as a child clinical psychologist. You know that a strong protective factor for kids is having one adult outside of their family that can provide that good stuff if their parent can't for whatever
Hmm.
reason, right? But the same science is true for parents. Like one adult for a parent is such a lifeline, right? In terms of providing that good social support, that connection, that ability to get outside of oneself and one's own context, right? Those relationships are strong. Now, it's really connected, though, to trauma, if you will, because usually what we see is when a parent has their own history of early adversity, like child abuse or like any of the adversities, right? Those relationships have probably enabled some of that trauma as well, right? So we always want these good, healthy, strong relationships to break those cycles. And so, yes, our work in prevention has to go way back to root causes. At least that has to be some of the work that we do. Certainly, it's more of the work that we do in primary prevention, but prevention is a whole continuum, right? So if we have a mom or a family that has experienced their own trauma, we know data show that it's more likely that their children will also experience that. But there's the opportunity to break that cycle, right? So much of the work that we do, even if it's after parents' own abuse histories, we can prevent it in the next generation, right? So that multi-generational or a parent dyad kinds of work, working across generations is really important. But the key thing is always those relationships, right?
Yeah.
Because we know that babies are regulating their brain in relationship with caregivers, in relationship with others, right? They're not able to regulate if their caregiver is dysregulated and not able, well, they're not maximally able to regulate if their caregiver is dysregulated, right? So you want mom and baby, dad and baby, caregiver and child to be able to like lean into that regulated brain, that good executive function, bond together, learn together, and really maximize their health and life potential. So I just think this work is all about relationships. It's all about partnerships. but we know that prevention is possible. And
Hmm.
so we want to maximize that possibility always. And we do that, like you said, in relationship across system. And so the last part that you said, across socioeconomic status, across neighborhood, I mean, the science is so strong that my children will do better if all of our children are doing better, right? We're
Hmm.
all interconnected. And so we sometimes silo the opportunities, right? And
Yeah.
we invest in different neighborhoods differently, and those are patterned and they're inequitable. And so the truth is, we want all of our neighborhoods to be doing well. We want all of our families to be doing well because ultimately, then we prosper as a nation. Our economy flourishes, right? Our relationships flourish. And really, today, the decisions we make today are setting the trajectory for our intergenerational prosperity, right? These are the leaders, innovators, parents of tomorrow today. So it really matters. Relationships really do chart the course for the world that we want our own children to grow up.
Yeah. And I think as you spoke too about the impact of trauma as well, we know that there's such beauty and hope when it comes to repair. Like we actually know now in the science that repairing a rupture and repairing trauma, not that we want those things to happen in the first place, but there's really a lot of beauty and healing from that and the repair that comes that actually makes us stronger as parents and makes us stronger as individuals to be able to model that for our kids and overcome adversity. There's that whole aspect that really brings us a lot of hope because, we want to prevent, but we also know that when we can't prevent and things happen, there is also the possibility of repair.
Absolutely. And it's so important, so beautiful, but so critical because nobody, doesn't matter how much money you have, where you live, what degree you have, nobody parents alone. And nobody is a perfect parent all the time, right? That is like a fallacy, such a myth that there's a good parent and a bad parent. I just do not think that exists. I think all parents are trying to do the very best they can do. And it's really in relationship, again, in the community, but with others in relationship that we're able to heal, to be resilient, overcome, and to make sure that we're, again, setting the trajectory for intergenerational well-being instead of intergenerational trauma.
Yeah, that's so good. Are there any other like myths around, or some of the biggest myths that you've seen about what child abuse prevention is or should be? Do you feel like the public generally gets it or understands it, or are there some things that you're just like, yeah, we have these ideas about what it means to prevent abuse that really aren't necessarily in line with what research shows, or that what you've seen in your experience?
Yeah, I think there are a lot of myths. And I think the first one is that there's a myth that child abuse is just going to happen in certain neighborhoods or with certain demographics or certain socioeconomic families. And that's a myth, right? First of all, we know that child abuse can happen anywhere. But the connected myth is that there's a bad parent that maltreats kids. That is not what the science or the data show, right? It's usually an overloaded parent. It's usually a parent that can't access all the things, right? That the environment is not rich with all the things that they need to be able to relate in a healthy way to their baby. We know that risk is shaped by systems and conditions, right? And it's not an individual problem. And when we acknowledge that myth that it's not an individual family, it's not a bad mom or a poor mom or a mom or a dad that lives in a certain zip code. When we get that out of there, then we know that if the problem is not individual, then the solutions can't be individual either, right? It
Hmm.
has to be societal, cross sector, like you talked about before. There's a role for all these different sectors. We believe there's a whole prevention ecosystem that has to exist to make sure families are in the best, supported with relationships and with resources, right? To really bring their best to this job of parenting. I also think people, it's not really a myth that this is complex, but I think people think it's too complex or too expensive to figure out. I think that's a myth. We know that prevention saves lives and actually is very cost effective, way cheaper if we get it right on the front end than trying to fix all of the downstream issues. We know that, child abuse and neglect and other early adversity are linked to like 9 of the 10 leading causes of death. Well, certainly when we then have all of those sort of sick, unwell, unhealthy people, we're paying a lot more than if we would have gotten it right on the front end. And also that we think, another myth is that it can't be measured. I would say our measurement is imperfect, that's for sure. But we know research shows a clear impact when communities are supported and have access to all the things, the relationships and the resources that we can really make a big difference in the prevalence and incidence of child abuse and neglect.
It's so helpful to really be able to get at the, like you mentioned, the root of the issue. It is complex, and the fact that it requires a lot of different interventions all at once, but it is doable. You're definitely speaking my language in the fact that we see a problem and we think that it's too complex, and so we bow out of the conversation rather than saying, no, I think we could put our heads together. We can come up with some solutions and really get to what is driving this and how do we get the people in the right places and the resources in the right places to really make a dent in this. From a research standpoint, what have you figured out in terms of what seems to work in prevention, and what are the things that you've seen like that we put resources here, it doesn't really work like we thought it would? And I mean, what are the things that you wish we could just keep multiplying, right? Because this is working. We wish that we could continue that and make it more fruitful. What would you say from that standpoint?
Well, I mean, in summary, I'll say what we have been doing and how our systems address the problem of child abuse and neglect is not working. And that's that we have very reactionary systems, right? We wait for families to be in crisis and to be known to our downstream systems like child welfare or juvenile justice or other downstream systems before they get services and supports that had they had access to them, they would have never been in crisis in the first place, right? So this shift from a reactionary system to a prevention, proactive system is really what we're trying to achieve. And it matches what the science shows works, right? Because we do know another myth would be that we don't know how to prevent child abuse and neglect. Oh, yes, we do. And we have decades of research that show that providing economic supports to families, right? Child tax credit, earned income tax credit, just things that help relieve a little bit of that economic pressure that are on folks. We know that prevents child abuse and neglect. It also has all these other good outcomes for families, right? It helps moms participate in the workforce and finish high school and like lots of good stuff. But specific to preventing child abuse and neglect, concrete and economic supports is a key one. I think also, like we were already talking about, relationships matter, right? Strengthening social supports, reducing family isolation, another thing from our kind of super imperfect data during the pandemic, but we really realized that when families were isolated from their social supports, right, that's when you really worry about the risk for children and for families in all kinds of violence, perpetration and victimization. But we know that strengthening those social supports does keep families safe. Parenting supports that build skills and reduce stress, right? So moving away from blaming and shaming families to really meeting families where they are. This is the great thing about home visitation, which is also proven to keep families safe and children thriving. We know that HFA, Healthy Families America, our program that's across the country in 38 states and DC and the 5 territories we have about 100,000 kids in that program each year. But what we know about that program is that it keeps kids safe and supported because it meets caregivers where they are.
Yeah.
It doesn't say like, oh, you're a bad mom because you're asking for help. It's like, actually, you are the superhero in this story, mom or dad or caregiver, grandma, whoever, right? And what is it that you need to work through? Or what challenges are you trying to solve? Also, community partnerships between sectors, we know. Again, this prevention ecosystem idea has lots of great evidence. Like how do we wrap around our families, right, with love and support? This is the work of love that we're doing, but it actually has measurable impact. And we all win when families are supported. So there's lots of evidence-based solutions. And again, they cost a fraction of what it would cost to fix these issues after the fact.
Yeah. And I think the cool part of that is that it brings into the picture a lot of the community supports that are already in place. So of course, here in the Riverside Project, when we run what's called the Response Network, where caseworkers at CPS, investigations primarily, but other caseworkers will bring us families. They'll refer families to us, and our role is to come alongside them, understand the root of what's going on. And it's usually a scaffolding of different needs. Maybe it comes to us as like they need diapers and wipes, but usually if there's an investigation, we're asking deeper questions of like, what else is going on here? Is this a childcare related thing? Do you need, support for counseling, grief counseling? What's going on that's really keeping this family in the system? And we don't meet all of those needs for them. We find out where they live in the community, and we're able to connect them to a church down the road who has grief counseling. We can connect them to the Houston Furniture Bank if they need furniture. It's usually, we were looking at our data recently, and like on average, I think it was like 5 different supports for each, if it's both resources and it's relationships. How do we get them connected to the right resources that already exist in the community? But how do we connect them to relationships in their community too? Is it a Hispanic church for a Hispanic family that can come alongside and walk with them? It's just pulling those pieces together. But like you said, it's resources, it's relationships, and it's blended together so that that family feels empowered, that I don't have to go back into the system. I actually have people in my life now and the resources that I need. We're still making it stronger and bringing as many community partners to the table, but it's going to be all of us that solves this. It's not going to be they send it to us and then we try to use grant money to fix everything, because it keeps the resources and relationships away from them. So it's neat to see that is lining up in the research, that the work
Absolutely.
that we are really trying to invest in, because we've seen that problem very, very closely in our community. It's always around us.
Absolutely. And I mean, honestly, it also matches like a whole other literature, like cultural anthropology. If you look at cultural anthropology texts, they talk about how from the beginning of time, it takes 7 adults to meet the needs of one child. And here we are thinking like a mom or a dad or a grandma or one person alone is going to meet all of the needs. No, it's like we have, our children have curiosity needs and stimulation needs. And I just know, like, early when I was a new mom and I was on postdoc and I was like, okay, I think I'm going to just stay at home with my baby for like 2 years and stuff. And after like 3 weeks, I was like, oh my gosh, they need so
I need
much.
more adults.
They need all the things to keep them entertained. But like the truth is that is just from the beginning of time, right? And that's when back, before now we had whole communities raising children, right? And me and helping each other out. And now we're so sort of individualized and siloed. We sometimes don't talk to our neighbors, right? When really we see that the social connection, even from knocking on your neighbor's door and giving them a meal when they have a new baby, or like during the pandemic, like, we saw these like love letters neighbors would leave for each other and stuff. That is like the connectedness that is just ingrained in our humanity, right? That we need to be able to thrive. And so it's like, that has just rippled and we're very far from that now. And I think in our sort of space, because we are so focused on making sure families have what they need in their own communities, delivered with love and all of that, that we are able to have family resource centers and home visiting and diaper drives and all of these things in the same community. I think that one of the main things that we do is just connect all of those, right? Sometimes they all
Making the
exist
connections
in a community, but you may not know, right? Sometimes the same program that a family may be going to, they're going to the WIC office, let's say, and they don't know that in that same building, there's home visiting or there's, a family resource center or someone that can connect them to other supports that they need. So it's really co-locating all of those things. And again, back to relationships are what get this done, right? It's about how do we build those relationships, those partnerships for prevention that are just critical and they're needed for everyone, right? Like the fallacy, again, back to the myths is like, okay, I have a PhD in child psychology and I'm employed and my husband is an attorney and whatever, and we're never stressed out. No, that's a myth. We're stressed out every day. But what do we have that some other families don't have? A phone number of a friend, a neighbor that can pick up our kids when they were little while we were running late, right? Or we can be there for another family when they need us. So it's that connectedness, that social capital, that unquantifiable sometimes that actually can make the difference too, right? And so I think it's again, we're happy when people are involved with child welfare and can get supports. But our idea is like, how do we make those supports available way before they have to call a hotline, way before a family is in crisis? That's what we mean by prioritizing primary prevention.
Yeah, for sure. And we think about child abuse as this like individual, it's an individual problem, or it's a family problem of a particular family in a particular neighborhood. And what we're really talking about is maybe it's a community problem too, and what's needed is not just a family solution or an individual solution, but it's a community problem that needs a community solution. I think that's what you're kind of getting at.
Exactly right.
Yeah.
Exactly right. And there's a role for everyone in the community then in helping assure everyone's safety, security, and prosperity.
Yeah. It makes me wonder like what it would look like for our entire community to see child abuse and neglect as a community problem that we're all looking to solve. That's
exactly what we're working on. And so one resource that I'm sure we can provide to listeners too is our blueprint for family well-being that talks all about a prevention ecosystem. And really, we're seeing it happen in communities, right? We know the whole school districts that are becoming trauma informed, let's say, right? That's one piece of a prevention ecosystem. But we want business leaders to see their role, right? This is their workforce of today, but it's also their leaders of tomorrow. So this is something they should care about. So yeah, there's really a role for everyone. And really, it's going to require everyone seeing it as in their best interest too, for us to really solve this issue. But it is solvable, right? Prevention is possible. We just have to do things in a new way, in a way that doesn't wait and say, okay, that's their problem, or that's for child welfare, these fragmented systems that again, often are seeing the problem too late. Yeah. How do we make sure that we can identify and address the needs of our families in our own communities, in our faith communities, in our churches, in our schools, in our, community organizations? Like we all wear many hats, and like I wear a mom hat, I have a role in child abuse prevention there. I wear a leader hat, I wear a community member hat, and we have a role to play in all of those things that are critically important to solving this problem.
That's super helpful. We work also with church communities. And I think sometimes the church community, my husband's a pastor, we care deeply about engaging the work of the church. We work with about between 120, 130 churches across the Houston area, really helping them to find their place, whether that's mentoring teenagers or meeting response network needs or coming alongside biological families. It could be mentoring, it could be doing a parent night out or supporting foster and adoptive families. There's so many different roles that a church can have. That churches are embedded in all of these communities and really do care about, supporting families and supporting their neighborhoods. Many of them, what we've heard is we just don't know what to do. We don't know where the families are that are struggling. How do we connect to them? People are sometimes intimidated walking into a church because they don't know what that's going to look like. And so I kind of wonder what, because they genuinely want to connect to families, what does it look like? Or have you seen meaningful engagement from the faith community? And what does that look like beyond just we run a background check and we do mandatory reporting and kind of the child protection, which is also very, very important, right? Yeah. What have you seen as the role of the faith community in this space?
So churches and houses of worship are critical, right? Because we know that parents are going to churches and houses of worship for parenting information. Like there's been lots of national surveys that I know of that talk about churches and houses of worship being in the top 3 always of where people are seeking information. And that's because it's a trusted community partner and place where people feel safe and supported and they know that they belong. It's because churches and houses of worship really facilitate and cultivate that sense of belonging, that dignity, that everybody wants, right? So I think the groups that are hosted there, like parent groups, and even just backpack drives when there's like back to school. I know of a Baptist church in Trenton, New Jersey. Our former board member Daryl Armstrong is the pastor there, but he hosts like big, drives, and thousands of people from the area come to get their concrete needs met, but also to talk and connect to other services that may not be delivered at the church or house of worship, but to connect to the other supports that are available in the community. So I think too, churches have a role in just being that like better of like, oh, this is a good place for you to
Hmm.
go. They'll treat you well there, that warm handoff, right? All of that,
Yeah.
it's really important because again, that unique trust and reach that churches and houses of worship have. So I think they're often the first to see signs of stress and distress in families. And so like they're really good at that. But like then the next step is like making sure that families know that there are these supports that exist around the community that are there for them, right? That don't confer stigma, right? It's actually you're a wonderful parent if you're asking for help, and I know that that can be really hard, especially in some demographics and in some communities, right? This like idea that like you don't want your kids to get identified as like and get your kids taken away and all of this stuff, and so it's really a social norm that we're trying to break. Actually, asking for help is a superpower, but also knowing how to help, as you're saying, like churches, I think have a huge role to play in that.
Yeah, and it makes me think that more churches, we want to equip them with referral sources too, because churches can't all do the same thing, and we can lean on them to do certain things, but helping them to actually connect to the other resources in their area so that they know when a family comes in, if they don't provide counseling, but they know of 5 different really good trauma-informed counseling centers around them, they can actually feel empowered to provide that referral to a family or an addiction recovery resource or something where they can actually provide more than just not, I don't want to say just prayer. It's super
Yeah.
important, but,
Yeah.
to feel kind of ill-equipped to know where to send them and how to help them at the root
Yeah.
of some of those more
Absolutely right.
tangible physical things. So
Yep.
yeah, that's helpful. I know you've worked also at kind of a national level on like research and policy. I'm wondering kind of if you could change something in not just in the child welfare system, maybe it's just policy in general, but where we would better prioritize prevention, what would that be? Or are there a couple of different things that you feel like we could just change this one thing or change these couple of things, we would be on a better trajectory? And getting
Yeah.
into the politics, I know, I mean, I don't
Yeah.
even want to ask that question sometimes, but I feel like you'd have good
Well,
insight.
yeah. Well, I'm like a broken record already because I think that the main policy shift that we need is to move from a reactionary system that waits for families to be in crisis before they get the services and supports that they need to a proactive prevention system that really, again, has helped destigmatized in communities, right? Every community has all of these supports available for whoever needs it. And to your point, then it's really about building the relationships among that prevention network and that ecosystem in that community to make sure all families know about it, right? So I think that is possible, but we must then rebalance our budgets, right? We have so much money in downstream systems, and we have such a little amount upstream in prevention. Rebalancing that budget book is going to be critical if we're going to do this work.
I'm wondering, do you feel like it is mostly in the budget? Do you feel like what's kind of the roadmap to get there? Is it change the policy, and reshift the budget? Is there anything else, like if you were to create a roadmap for how we get there, what do you think needs to be in place?
Well, sure. There is a roadmap that we've kind of created in our blueprint, right? It's the mindset shift. It's this idea, again, the dominant narrative in our country is that a bad mom or a poor mom maltreats her kid. And so the truth is that like we all have a role to play in keeping all kids safe, right? And that we all benefit when we do that. So I
Yeah.
think that shift in mindset, that transformation of the narrative to it's not an individual problem, it's a community problem where it's all of
Yeah.
us problem, that means we need all of us solutions. So I
Yeah.
think that is the roadmap. I think that is where it starts. That is
Yeah.
hard,
That's good.
but it comes from telling stories, right? Uplifting stories. It's all moms like telling the story. Like again, there's no perfect parent, and dispelling the myths and really providing the truth that everyone's trying to do the very best they can, but they have so much on their shoulders, right? So how do we just lighten the load for families? How do we keep parent child relationship and bonding and all of that across the lifespan at the core, right? It's not just for babies that need bonding with parents or with caregivers in their community. As I said in the beginning, it's like, kids need that with other adults not in their family. adults and parents need that from other adults in their community. So it's really, I think, in that mindset shift that we start, and then our policies can follow. But again, it's the shift from waiting to fix problems versus starting healthy and well and thriving and keep that going.
Yeah, it sounds like there is kind of that macro at the top policy shift that has to happen, but it's also the micro, me and you and our neighbors all opening their eyes to, hey, we're all at some point interacting with families who are struggling, some in all types of different forms. But I think if we even just open our eyes and see the family, the neighbor, the person at my kid's school who, really is just struggling and I can tell doesn't want to ask for help, being able to be a kind of a champion and empower them and say, hey, can I help? Can I step in with you, and coming near, that's like that proximity, being willing to get proximate to someone who's struggling, even if it's just like one person.
Totally.
That does change things from the ground up, is what you're saying.
Absolutely. Because, we know any big policy move that we're going to make is going to be how proximate is said policymaker to the problem, right? It's all, like a lot of issues. It's because they have someone in their family that struggled with that problem, or they know someone in their community, one of their constituents that brought this problem to life, right? So I do think it's about proximity to the problem, but also that means proximity to the solutions, right? Because let me just say, there are so many strengths in every family, in every community, but we are almost trained to see all of the risks as opposed to all of the opportunities and potential for change and for prosperity. And so I think it's just telling our stories, having people with lived expertise at the table, partnering, co-designing the vision, right? And we did that with our blueprint. I'm really proud of it. Our North Star is that all children and families are living a happy and purposeful life with hope for the future. Doesn't have the words child abuse and neglect in it at all, right? Because it's something that we need everybody to be doing, correct? And it's much bigger than that. And if everybody truly was living a happy and purposeful life with hope for the future, we would have eradicated this problem, right? Of child abuse and neglect. We'd all have what we need when we need it in our communities, and we'd know where to find it with love and dignity and belonging. And we wouldn't have to feel less than for needing some support, because actually everybody needs some kind of support sometime. So I think it's that mindset shift, that transformation of the narrative is where we start. And it's in conversations like this, and you bringing this topic to your listeners in Houston, and just, doing this around the country in every community. There's something that very hopeful and very, we're able to celebrate possibility.
And I think that's what, months like April, when we're all able, I don't know how you feel about just, sometimes when you have just one month, like we have National Foster Care Month in May, and it's when everybody talks about it and all the business, different. And it's just like, well, let's normalize it throughout the other 11 months of the year too. But it does give us a time to really be more introspective on what are we doing to prevent this? What can I do as a citizen? What can I do as a leader? And so we're excited this month to be able to highlight the issue, but also come up with some solutions. And so we'll definitely be sharing the blueprint that you have, and really we're going to come up with some additional ways to be able to just help people get involved, and get more proximate, just even if they're taking a very small step towards what I can do as an individual or a citizen here, Houstonian, to prevent child abuse this month and then the rest of the year as well.
Yeah, I love that. I agree. It's a year-long initiative. I will say that our theme this Child Abuse Prevention Month is Pinwheels of Possibility. Again, focusing on what we're trying to achieve together. And when we center families through every turn, that's sort of how we're bringing life to our pinwheel these days. It's just, that is the way forward. That is how we prevent child abuse and neglect from ever happening, right? Centering families, centering humanity, and doing that always in partnership with each other.
Yeah, that's so good. Thank you so much. As many of our listeners know, we usually take the last couple of minutes to do kind of what we call the last five, which is just a little bit less intense conversation than what all of the many things that we've talked about, just to learn a little bit about who is Dr. Merrick, and what are the things that you enjoy, things like that. So
Sure.
the first one is, what's the best piece of advice you've ever received?
I receive a lot of advice and take a lot of it to heart, but I have to say recently I learned from another woman CEO. She said, "We can't light ourselves on fire to keep other people warm." And I just thought that that was really impactful because, and that really means like, we're going to burn out. And this is not like a sprint, it's a marathon, right? We're talking about systems change and narrative shift and things that'll take potentially a long time. And we have to be here for it. We have to be healthy. We have to care about ourselves and prioritize our own self care at times without that guilt that all working moms have, all working people have probably. But and just recognize that like we can't burn out because this issue needs us all well and here for it. So never set yourself on fire to keep other people warm.
Yeah, that's good, especially in the helping professions. I think it's doubly helpful. Do you have a favorite quote or phrase, and why? Is there something that you always go back to?
So there's one here on my desk that I got from one of our national sorority partners. It's Susan B. Anthony, who says, "Wherever women gather together, failure is impossible." I really like that one because I mean, the women part, yeah, okay, I believe that, but I think it's really about connectedness, right? I think it's like Margaret Mead says something similar, and that never doubt that a small group of thoughtful, committed citizens can change the world. This idea that it's a collective, right? That's what I like about these quotes. It's like, it's not just one person. Yes, one person can make a great impact, right? And this is my life's work, child abuse and neglect prevention. I know that when I'm long gone, like I would have made an impact. However, the impact that I truly make is in partnership with families and other leaders and communities. And it's that together component, that togetherness that's really going to move us forward.
Yeah, that's so good. Is there a bucket list item that you're determined to check off?
Oh my
Do you
gosh,
do a bucket list?
my bucket list items are about food and drink and travel.
Great. Those are the best kind.
My newest one is to go to Lake Como in Italy. I've been to Italy, but not to Lake Como. And I just love beautiful things. I'm from Miami originally. I like water anywhere and I like sunshine everywhere. So in Chicago,
Okay,
many
you live in,
not
yeah,
may not
Chicago is
know,
very different than Florida.
but it's very sunny, even in the winter, and we can see a little peekaboo of the lake here. So it's good for my mental health. But yeah, I think sunshine and food are like on my bucket list always. So
Yeah, and Italy is a great place to get all of those
all
things.
of those things.
If you could change one social norm overnight, this might be something we've already talked about, but it could be something different. If you could change one social norm overnight, what would it be?
Well, I do think it's something we've probably talked about, but like just seeing family challenges as our challenges, right? It's not like their problem; it's all of us, and this like community responsibility for well-being. I think is a really powerful one because I know that when we're able to lean in to that and have norms change, and that many things will be possible, right? It will unlock a lot of goodness, and so I think that's the one I really hope to change overnight, but it might take a while. But
Yeah. Hey, it's one day at a time,
yeah,
right?
one day at a time.
Okay, last question. What gives you hope right now outside of your professional work? Is there anything that gives you hope?
Well, my children give me hope. Young people give me hope, right? We have two sorority partners that support Prevent Child Abuse America. And to see young women just hustling hard and doing these great events and raising lots of money, but really because they believe that the future is bright and that everyone deserves a bright future, right? This idea that it's not reserved for some people and not others, it's actually for everyone. This is something that spending time with young folks, including my own kids, I just realized that like change is possible and prevention is possible. And I'm really excited about what's to come. I have a lot of hope for the future.
Yeah. And how much more enjoyable the work is when we're all running in the same direction or maybe not exactly the same direction, but like we're all in it for the same things and working together on it. And I think it just keeps me going knowing that there's other people working for the same things. And we may not be doing exactly the same work, but even, between our two organizations, knowing that there's more people that care about the things that we care about and are working to the same end, it really keeps you going.
It's
Yeah.
like a relay race, I heard someone say, where it's like you're getting the baton to a certain thing, and then you have to pass it off, right? So that you can refresh and evaluate and measure and all the things, and then come back uplifted to take it over again, right? So I do think that again, partnerships are incredibly important here, and literally there is a role for everyone in this work. So just thankful for all of the people listening, for the role that you play in making sure the future is bright and filled with joy and love and possibility.
Yeah, that's so good. Well, we're super grateful to have this conversation. We're thankful for the work that you've done all the way up until today. You've have a ton of experience and have done a lot of research in this space, but you're advocating maybe more than anything that you do. You're advocating and helping us to be better in this space. So we're really grateful to know you, to share this conversation. And thanks so much for being on the podcast today.
Thank you. And likewise, happy to know you as well.
To those listening, we hope these conversations have inspired you to find your place along the river. And we welcome you to join us in bringing hope and renewal to the city of Houston. If you'd like more information on how to get involved, please visit riversideproject.org and submit a contact form. We'll see you next time.